Welcome to the 354th Fighter Wing Live Coronavirus Virtual Town Hall. Today is April 14th, and this is our 6th update to the wing. I'm Kay Nissen, and today we have with us Colonel Benjamin Bishop, the 354th Fighter Wing Commander, Lieutenant Colonel Dr. Matthew Ramage, 354th Medical Group Chief of Aerospace and Medicine, and later Chief Master Sergeant Stephen Hansen, the acting 354th Fighter Wing Command Chief. We'll be taking questions in the comment sections throughout the show, so please let us know what's on your minds, and we'll be sure to get to those questions. So up first is the update, where we will fill in all of the changes from last week's show. So let's start with the doc here. Where are we at right now with COVID numbers, and what's the trend line looking like?
Yeah, okay, thanks for having me. So right now in the Fairbanks North Star Borough, we're looking at 78 total cases for the COVID pandemic. The state totals, we have 285. This is important because there has only been 5 new cases in the state of Alaska over the past 24 hours. This is an indication that we are flattening that curve. Just with the local distancing and enhanced hygiene practices that we've done on base, we have seen in clinic a significant decrease in respiratory infections and other infectious diseases. Now, it's important to note that the interior of Alaska in the borough is a very high density testing location relative to the rest of the United States. So we have a very tight pulse on what the cases look like. In the nation, we have about a 2 to 4 day doubling time for cases. But in the borough, because of how effective we've been with our social distancing and our hygiene practices, we're seeing that doubling in about 10 to 12 days. So we are truly flattening that curve.
That's great. I mean, that's good news, right? Does that mean that we need to change anything, or just...
No, we need to stay the fight. We're doing exactly what we need to do, but if we let up now, that's a surefire way to have us lose all the gains that we've gained so far.
Got it. All right, so we're staying the course when it comes to social distancing and all that. We have some more policy updates, I think, that changed from last week. So, Colonel Bishop, what's changed as far as what we're doing on base differently from last week?
Yes. So, thank you all for tuning in and joining the conversation here as we combat COVID. And like the doctor just said, this is good news. What we're doing, what you are doing, is working. We are flattening the curve. We see that on the installation. As you probably noticed, we don't report installation numbers just for operational security concerns, but what I can tell you is our numbers are extremely low, and the data that we're seeing, it reinforces everything that we have formalized in command directives. So there has been a few changes on command directives since our last meeting. The first one is on face masks. So you've probably seen that in the media, but face masks will be worn by everyone on the installation when you're out in public and you can't maintain 6 feet of physical distance. So highlights there, if you're going to the commissary, if you're going to the BX, if you're going to any of those public spaces, you're going to need to wear a mask to go in those facilities. Just because I can't guarantee an environment where you can maintain that social distancing. So the other kind of news that you probably see is the governor's mandates has been extended. So school is canceled for the rest of the year. I'm sure all parents that have school-age children are aware of that. But that just kind of shows the time horizon. Like, we are doing great work here, but we need to continue to adhere to these directives, to adhere to social distancing, personal hygiene, wear a mask when you're out in public to the max extent possible. It's mandated if you're going to be in that close proximity or in those environments. So this is good news, but again, like the doctor said, we need to keep doing what we're doing.
Excellent. Yeah, I think I've fashioned my own mask for when I come to work, so it's been an interesting change, but I think kind of like the accessory, actually, now that we get to wear them. But anyways, those were the updates that we had for today. We're going to turn to the next break where we're going to take some questions. So please submit your questions if you're listening right now. Thanks for tuning in. And right after this, we'll take some rapid fire questions.
Here's how you can make your own face covering in a few easy steps with items you can find around the house, like an old scarf, a bandana or a hand towel, or you can make a face covering out of an old t-shirt. Fold it to the middle from the bottom, fold it to the middle from the top, fold it again to the middle from the bottom, and again from the top. And then 2 rubber bands, one on one side and one on the other side. Then you fold either side to the middle and you have yourself cloth face covering. It's that easy.
The commanders on base have done a really good job about reducing the amount of people in the work center to the maximum amount practical. This is done to minimize the amount of people that would be vulnerable to get sick. The next step is up to us. In addition to washing our hands frequently, we also need to maintain good social distancing discipline. More importantly, do not come to work when you're sick. If anybody in your work section should happen to have symptoms, but you've maintained good social distancing principles, chances are you're going to be fine. If they happen to go on to later be diagnosed with COVID, Public Health will perform an interview and a contact tracing, looking for any substantial contact that a member has had up to 48 hours prior to the onset of symptoms. If it is determined that you are a close contact with somebody diagnosed with COVID, you will be directed for a 14-day quarantine. If you should have any symptoms while you're in quarantine, you will be tested and then a contact tracing interview will be performed on you. This underscores the importance of maintaining social distance principles. If COVID should enter your work section, this will minimize the impact on the mission. Readiness is job one, and the continued good health of you and your family members are key to maintaining full mission capability. A common question that I get is, Doc, what if I'm exposed to somebody who is put into quarantine? Don't worry, this isn't like the 6 degrees of Kevin Bacon. If they are later diagnosed with COVID, you will be notified, and you yourself will be placed into quarantine. Now remember, just because you're in quarantine, this doesn't mean that you're going to get COVID. This is precautionary to make sure that you're not going to have any symptoms and to keep you out of exposure with other people if you should develop symptoms. I want you to stay safe, wash your hands, and remember, don't lick doorknobs.
Welcome back. During the break, we just heard our very own Doc Ramage. Though in that clip there, you were actually in a Hawaiian shirt. You're a little bit more appropriately attired here right now. We were talking about contact tracing in there, and now we're ready for some rapid fire questions. So let's start with the first one. So masks have been quite the topic in the last week. So number one question that I've seen kind of pop up on Facebook is, are cloth masks effective? You know, are they actually useful in stopping the virus or stopping the spread of the virus?
Absolutely. So before I answer that question, let me just kind of walk it back a little bit. There's really 2 types of masks that we have. There's the masks that protect yourself from other people, and there's masks that protect other people from yourself. So the medical masks, those tight-fitting N95 respirators that we wear when we're seeing folks with known or suspected disease that we're wearing, they keep the virus from getting in. The CDC recommended the cloth masks, the face coverings, for folks that can't maintain that 6 feet separation. That's basically just an extended wear elbow so that you're coughing into something and not spreading your cough bubble around. It keeps those respiratory droplets from spraying out in a big pattern so that you can contain in the event that you are shedding the virus but not yet having symptoms. This is important. The more people that are out there wearing these face coverings in public, especially in those areas where we can't maintain that distancing, the more contained that we'll have if anybody does have these asymptomatic spreading. Now, I do want to reiterate, the mask, the cloth face covering or the loose-fitting masks, they are not a replacement for social distancing and good hygiene practices. continue to do that, but they are to enhance that those distancing practices.
Got it. So I've seen people, we've had a great community response. People started to make masks, start to donate masks. There was a little bit of confusion on if we could use old uniforms for masks. So I heard that's not a good idea, and could you explain why that is?
Absolutely. While it would be really cool to have some OCP pattern or ABU patterned face coverings, there is a good reason against making your face masks out of those. With the DoD, we go into some dangerous situations, and so the uniforms are there to protect us. Some of these uniforms are treated with a flame retardant material, and some materials are also treated with some insect repellent. We don't have any data that shows long term what it would be, what dangers you might be faced if you're long term breathing through this material. While it's safe to have this material on your body, that's been tested very significantly, but we don't have the data of breathing through this fabric for long periods of time. So just as a general rule, just because you can never be sure what your specific uniform fabric has been treated with, if we recommend folks not make their masks out of uniform materials, that's the best thing we can do to stay safe from a potential unknown danger.
Okay. So speaking of masks, one of the other questions that got brought up is, obviously it's now mandated to wear masks in the grocery store. But I had seen other people ask if we're allowed to bring children into the grocery store anymore, since we are considering it to be a place that a lot of people go to. So, sir, I think you had a little bit of information on that.
Yes, that's a great question, and really the answer is it depends. If your children are sick, you need to keep them home. And if they need medical attention, then obviously contact our medical group team to make sure they get the treatment they need. So if anyone in your party is sick, then they just need to stay home and minimize the risk of spreading coronavirus. However, if your family's healthy, I encourage you to try to minimize the people going into the commissary. So Aaron and I, we kind of take shifts. Running as individuals and keep the kids staying at home. But if you're in that situation where that just isn't possible, for example, we have deployed members currently, and sometimes there aren't any options. So if that is the case, then absolutely your children are welcome to go into the commissary. I will say if they're above the age of 2 or 3, then they're going to be expected to wear a face mask. So that is something that we need to kind of educate our children as well, just that environment. I will say if you're in one of those situations where maybe you have sick kids and you're a single parent and you're having trouble getting out the groceries, please reach out to your chain of command. We will get you the support that you need. We'll make sure that you're taken care of. And then we're also looking at avenues to perhaps be able to do curbside pickup or even delivery at our commissary. So that is an effort, innovation effort that's in the works, and I hope to have more information on that to follow in the near future. But again, just kind of think the effect that we're trying to do: social distancing, minimizing any social interactions or close contact, and obviously the BX and the commissary are high traffic areas.
Okay.
So if there's any follow-on questions, please feel free to post them in the comments. We'll make sure those get addressed.
Got it. All right. So on the subject of children, there were some discussions on mission essential at the CDC versus not mission essential. So can you just explain? There is a current policy in place that says mission essential kids only at the CDC. Can you just explain what that means for everyone else?
Yeah, that's a great point. So I spent about an hour with our CDC, our teammates at the CDC last Friday, and I will tell you they are just amazing Americans doing great work for our community, while watching our children, while our mission essential personnel are getting the job done. And I would like to just kind of reinforce the intent of the CDC right now. Our Child Development Center is we are marshaling those resources to support those airmen who need child care so that they can go to work and get the job done. So what the Child Development Center is not full right now is to drop your kids off so you can do recreation or you're staying home. So you have the capacity to watch your children and remain at home, then please do that because we want to minimize the risk to our CDC employees and also the risk to our children there as well with the spread of the coronavirus. I will say if you have the opportunity to thank them, please do so. Because they are helping us, or they're a key enabler for our mission. I know there's probably some questions. Maybe some folks don't are mission essential, but maybe they're on a shift. And if you have questions about whether or not you'll be charged if you keep your children home, please raise that to the CDC employee. We'll get those questions answered. The bottom line is we're going to do everything we can in order to make sure you don't get charged for a service that you're not provided. So if that's a concern, please again highlight those questions so we can get them answered.
It's actually a really good clarification. So if I'm sure like most offices, you have a mission essential function, right? So maybe you're not someone who has to go into the office every day, but you do have to go to the office maybe once every 2 weeks for a week straight. So how does that apply for them? If they're expected to telework from home with kids, can they still bring their kids to the CDC, or should they just plan on not doing that? Even if they have a job to do.
Yep, those are great questions, and the best way to kind of get those questions answered is through the chain of command, because there are some people that are going to be mission essential functions that can work from home. If you can work from home and still provide, take care of your children, that's kind of the best scenario. If you're not able to do that, then obviously, work with your chain of command in order to get the CDC support that you need. But again, the more we can minimize the traffic in the CDC, the better it is going to be for our mission, and really it supports our priorities for caring for our airmen and our families while we continue to safeguard our mission and support the communities.
Great. I'll note Colonel Wempe just chimed in from Facebook land and just said, hey, members will only be charged for the days their children are at the CDC, and they're not required to charge by the week during this time. So thanks, Colonel Wempe, for chiming in there. I think for the last question here in our Q&A, I haven't seen anything else pop up, but this might be for you, Doc. We have models, we have trend lines, we have all these things. How much longer is this going to go on? I shocked myself a little bit when I was like, oh, this is the 6th update, So we've been going at it for about 6 weeks now. It seems like a long time. I'm sure a lot of other people feel the same as I do, where it's like, man, when is this going to end? So any thoughts from you on this?
Well, let me take this time to give you a very unfulfilling answer, as long as it takes. And so what we don't want to do, we've shown that our efforts are doing exactly what the intention is, to keep the cases low, to preserve those medical resources. We need to continue this until which point we are going to be fairly certain that backing down on our restrictions will not lead to a second spike, because that would take away all the gains that we've gotten so far. Mm-hmm. So we just need to be patient and continue the fight like we're doing right now.
And a second spike just means like it would just be another wave of,
Correct. If the virus is still out there, and if we relax our social distancing and relax our hygiene, that potentially could cause a large wave of infection, as if it were just coming into the state for the first time.
Okay, great. Well, I think that's it for rapid fire questions. If you want to keep questions coming, please comment in the thread here. We're going to take a break, and when we return, we'll start our scenario segment.
Hi, I'm John Brooks with CDC. We've been getting a lot of questions about whether drugs like ibuprofen can worsen the course of disease and make you sicker if you get COVID-19. Well, let me tell you what we know. We review the scientific literature regularly and speak to colleagues, and at the present time, there's no compelling evidence that ibuprofen and other drugs like it can make you sicker if you have COVID-19. Now, we're going to continue to monitor this situation, and if things change, we'll tell you. But there are things you can do so you don't even have to worry about COVID-19 by preventing you from getting it. Those things include washing your hands on a regular basis, as well as maintaining social distancing. That way, you don't infect other people and they can't infect you. Let's work together to keep ourselves, our families, and our communities safe from COVID-19. If you want more information about COVID-19, go to www.cdc.gov/COVID-19.
Here are the top 10 things you can do if you think you might have coronavirus or COVID-19. 1. Stay home. 2. Monitor your symptoms carefully. If they worsen, call your healthcare provider. 3. Rest and stay hydrated. 4. If you have a medical appointment, call ahead and let them know you may have COVID-19. 5. If your symptoms are severe, call 911. 6. Cover your cough and sneezes. 7. Wash your hands often. 8. Stay away from others in your home. Use a separate bathroom. 9. Avoid sharing personal items. And 10. Clean all surfaces that are touched often. For more information on COVID-19, visit cdc.gov/COVID-19. Let's take care of ourselves and each other.
Attention all 354th Fighter Wing active duty airmen. The base commander has restricted all non-essential movement and directed mission essential reporting with an emphasis on teleworking. Eielson Air Force Base is currently in Health Protection Condition Charlie. View an up-to-date list of facility closures at eielsonforcesupport.com. Upon arrival to Hersey Gate, present your ID with the barcode exposed and ready for scanning. Do not depart until instructed to do so. For more information and to receive the latest updates about novel coronavirus 2019, visit eielson.af.mil/coronavirus.
Welcome back to the 354th Fighter Wing Coronavirus Digital Town Hall. We're going to start our scenario segment next, which is where we pose specific scenarios we've heard around the wing and get the take of our two esteemed colleagues here on what airmen or families should be doing in these scenarios. So, Colonel Bishop, Doc, if you're ready, we will start scenarios. First one that we actually saw on one of the spouses pages. So, I live in a neighborhood where unattended kids have been coming to my door, ringing the doorbell and asking if my children could come out to play. I'm a little bit concerned that they seem to not understand that there is social distancing in place, or maybe that their parents are not instructing them to stay away from other children. What should I do in this scenario? Do I try to follow the kid back to their house and let their parents know, or do I call security forces, or how should I handle this type of situation?
So I will say it is starting to get really nice out. This weekend was glorious. I was out with and my spouse Erin. We were both outside with our kids getting some exercise. The bikes were out, so kids are going to be out and playing, which is good because they need to go out and exercise. However, in that environment, we need to make sure we are educating our children to maintain that social distancing, because there's a reason why they're not at school, is because we need everyone to stay away, and that includes from each other, and that includes our children. So education is key here. And there's also a saying we all know, it takes a village, right? And I would say this is a village mindset, community mindset we have to make sure. Our focus here is on education, making sure that we all know what is the right thing to do, how we participate in combating COVID, and how our families participate as well. So if you have that environment where the kid comes to the door, I will say encourage that, explain to them that they shouldn't be doing this. If you know the parents, then I encourage you to reach them out to those parents. If it happens to be one of my kids, please reach out to me so I can do that education for them as well, because they really shouldn't be doing that. I will say it's going to be challenging as well because kids like to play together, especially when it's nice out. So that's we're going to need probably a little more supervision than normal out in the neighborhoods, and that's no exception for my neighborhood as well. So Erin and I were just talking about this last night actually. So really, we're in all this together. So we're in here to provide mutual support and with our families as well. And if you're in that situation where someone is reaching out to you and saying, hey, your children's doing that, I encourage you to say thank you, right? Because this is how we get through this, is by supporting each other for the greater good, which is minimizing the spread. Again, like you heard before, our numbers are extremely low on base, and across the community, we want to keep it that way. And this is how we're going to do it.
Great. So that's kids recreating. Let's talk about adults recreating, and that's really this next scenario. So me and my friends live in the same neighborhood. We really want to just meet up together to have a bonfire, and we know we can maintain 6 feet of distance apart. Are we going to get broken up by security forces if we, stand in a circle away from each other on base? What's the consequences there if I want to do that?
Yeah, so the consequences are if we don't adhere to these mandates and we start socializing, getting within 6 feet of each other, then we can start spreading COVID. And it only takes 1 or 2 cases for this really to run wild because it is so contagious. So that's the big consequence. And I think instead of looking at the letter of the law, understand the intent and what we're trying to achieve here. So we are combating COVID. We're minimizing our interactions, in close physical space in order to do that. But we're also still connecting with each other because there's another threat out there, and that's just we're going to break up, and then it can be mentally challenged and spiritually challenging for everyone. So we're going to create the environment where you can connect with each other. However, it really shouldn't be in close proximity. So as you're kind of circling back to the scenario, the fire pit is. If you have a fire pit in your yard and you want to go out with your family, that's highly encouraged. But we probably shouldn't be having any gatherings whatsoever. So in terms of is your fire pit going to get broken up? Well, if there's a crowd of people there and there's not social distancing, yes. I mean, our security forces may break that up. They will enforce these command directives because they are lawful orders. However, the focus is not on enforcement. The focus is on education right now. And what I'm happy to report is that we are, by and large, we're all following these directives. There's 1 or 2 exceptions, and we're handling those through command channels, and we'll continue to do it. But what I want to focus here is, maintain that social distancing. If you don't have to go out, please don't. And if you have questions regarding the guidance, you can refer to Command Directive 14. That's on our web page here. And specifically what the guidance I've said is there are limited movements on Eielson Air Force Base. So all personnel will limit on-base activities, travel and miss essential work to obtain food, essential supplies, seek medical treatment, and for physical exercise. So that's kind of a good framework. Realize that if you live off the installation or you're not on the installation, you need to adhere to the governor's mandates and the health mandates. And those, obviously change over time. So I encourage you to be educated on what those mandates are. So right now, social distancing is mandated. There's no interstate travel, so we are not to be traveling between communities. And there's guidance that's coming out regarding fishing, so there may be some opportunity to do that. But again, whenever you're in any environment, you need to maintain that good social distance outside of 6 feet, and wear a mask to the max extent possible. That will help you, especially as you go into those kind of public areas like stores, etc. Then on-base, commissary, and BX, those are mandates. So that's kind of a long transmit session, but a lot of these situations will vary. But again, we're doing great work battling this threat. So let's keep it up.
All right, we'll move to the next scenario, which is kind of touches on governor mandates, but for outdoor recreation, if I'm going to plan with my family to maintain social distancing when we go out to hike, for example, what point are things off limit? Because we're trying to plan to go to Kastner Glacier while the weather is nice, and we would like to travel there as a family unit, go see the glacier, and then come back. Would I be allowed to do that, or would I be in trouble for doing such a thing?
So I would say, again, reference the governor's mandates because those change. And right now, the interstate travel mandate is limiting travel between communities. So that glacier you just mentioned is in a different borough. So we should probably stay within our own borough if you're going to recreate And there's great hikes in the local area here that you can go remote and stay active. So I encourage you to look for those opportunities, devices traveling across the state. Because just realize that whenever you go on the road, there's risk there. There's risk of breaking down. We definitely don't want to be stopping in other communities like Delta Junction for supplies or anything. There's also risk for you being injured, and we don't want that to happen in another community. So again, I would focus on the ability to understand the intent, making sure that we're adhering to those government mandates when we're off the installation, knowing what those are, and then in general, the more that you can limit that transportation, the better it's going to be for everyone.
Yeah, Doc, I don't know, I had heard a little bit about sometimes the interstate travel is limited because you don't want those accidents happening, right? And I think I had read on the mandate that it was, people who are outdoor recreating, if they're not being careful, then you actually create a problem for the medical career field. And I don't know if you've seen that or if it's been very quiet in the medical group.
So, like the Colonel was mentioning, anytime that you're out there having fun, especially in Alaska, there's an inherent danger. The last thing we'd want is being out, enjoying nature, and getting significantly injured. As a serviceman and woman, you are potentially putting yourself at risk of having a non-line of duty injury that would have some significant administrative as well as health impacts to your career.
Yeah, interesting.
Stay careful, stay home.
Right, so take limited risks if you are recreating is what I'm kind of tracking there. So next scenario that we have here is about going to Bassett. So I live off base in North Pole. I felt a little bit sick, and I, instead of going to the on-base clinic at Eielson, I elected to go to the Bassett facility. What do I need to do differently if I go to Bassett for testing or for any care?
Well, that's a great question. So I'm going to back that one up just a little bit. We have for our 354th members, we have a medical clinic here on base that is uniquely postured to evaluate and test, if medically appropriate, for COVID. If during the duty hours, 7:30 to 16:30, Monday through Friday, and 7:30 to 16:30 on the weekends, we have a call number that we can provide later. If you're having symptoms, please come to the clinic first to be evaluated, and if you're tested, then we can provide that feedback to your unit and track your numbers, your results accordingly. By going to Bassett, potentially, that's at Fort Wainwright. By going to Bassett, potentially you might be short-circuiting the notification piece and potentially putting yourself and your fellow unit members at risk if that doesn't get back to your unit, that you should be isolated. Plus, their guidance is going to be a little bit different than what our wing mandates have. So please, unless you're having an emergency situation, make the clinic at Eielson your first stop.
All right, can do. And let your supervisor know too, probably would help
Absolutely.
Avoid all of that. All right, great. Well, we're going to take a break from our scenarios segment. Thanks all for who are tuning in and listening right now. You're listening to the Coronavirus Digital Town Hall for the 354th Fighter Wing. We're going to take a break, so stay tuned.
Hello, my Eielson community. This is Major Gladfelter again, or Major G. Wanted to take a few minutes to talk about some additional tips for managing the stress of social distancing and quarantine, and honestly just the general overall managing stress. It is definitely a period of uncertainty right now that we're all experiencing. So I guess first off, I want to say it's normal to be nervous. It's normal to feel uncertain about the future and to worry about our health, worry about the health of our community, the health of our families and friends all over the world, really. So wanted to say that. The other thing I wanted to talk about is just that when we are experiencing periods of stress, it has an impact not just necessarily on our mental health, but also thinking about our physical health. So our bodies are really adaptive. I mean, we have amazing bodies, super adaptive, little bags of chemicals and things that our bodies are made up of. However, our bodies, so for example, our hearts, our brains, things like that, don't necessarily recognize that we are having a stress response to something like a global pandemic. Our body just interprets a stress as a threat to safety. So you can imagine if I've got a threat to my physical safety, my body's going to respond in a lot of different ways. My body's not really going to be worried about sleep. So my sleep might be a little bit off. My appetite might be a little bit off just because my body's not necessarily thinking about need for nourishment, thinking about need for survival. So we might notice our appetite a little bit off. We might notice too that we just have decreased concentration. So it might be harder to focus on something like a book because my brain and body are like, reading? Who needs to read? We need to survive. So we might have some decreased concentration. We might also have some increased focus on the negative because again, our brain doesn't necessarily know what type of threat we're under. Our bodies and brains are really just in that survival mode, so it makes sense that we'd be more focused on the negative. Given that would be adaptive to survival. Way better to pay attention to a rustle in a bush and think that it could be a bear versus, oh, it's just a nice breeze. Because a bear is going to kill me, a breeze wouldn't. So sometimes we tend to get more focused on the negative when we're in a period of stress because it's adaptive. So first remembering that, and then that's really just important for us to realize like, okay, now that I know this, I need to manage this through things such as exercise, trying to maintain my routines, those social connections that we have, as well as maybe now's a great time to try some new relaxation things. Some of the great apps out there are Headspace, Insight Timer. Just check out some different apps, YouTube videos. Take maybe just 5 minutes to sit down and do some mindfulness exercise, maybe every day, making it a part of your routine. This would be a great opportunity to experiment with that. The other thing to remember is just that, hey, we are more focused on the negative right now. So it's a great opportunity as well to do some gratitude. So thinking about maybe 3 things you're grateful for every day could be another part of your routine to add. So good luck everybody out there in managing this stress. You all have the tools and know what to do. It's just kind of implementing them in creative ways. So again, thank you for the opportunity to connect with you, my Eielson community, and helping me maintain my routine. Thank you.
You're listening to the Coronavirus Digital Town Hall. Welcome back. You just heard Major Glotfelter from the medical group discussing how we process stress during this time. And we're going to talk a little bit more about this negative off feeling that some people may be feeling right now. And joining us is Chief Hansen. So welcome, Chief. How are you?
Thank you. I'm doing great.
Great. So I loved Major Glotfelter's talk about stress and how people are just feeling off right now. I know it definitely resonated with me, and I'm just wondering what your thoughts are on how we battle negativity and how we battle these feelings that we're having while dealing with almost 6 weeks of coronavirus.
So I'll tell you what's kind of working for me and kind of my approach to it, because that's really all I can speak to with this. I know personally I felt stress associated with COVID, just around the house and even talking with my wife. Like it's a change that we're all going through that we weren't expecting, and it wasn't something that we were necessarily looking forward to. I know there's a kind of a thought pattern out there that, hey, it's going to be over soon. We're going to push through this, which I think is good, but I think that can be kind of defeating in the end. This is a marathon, it's not a sprint, and this is potentially going to play out for a while. So I think kind of having that it'll be over soon mentality was kind of exhausting after a while, because you see it kind of continuing on. I mean, 6 weeks now or so, it's going to continue. So I think a better approach that's worked for me is finding my new normal. getting in a groove, making sure my day is kind of set up like it was before, but post-COVID or with COVID, to where I'm doing the social distancing, doing the protection, that sort of thing, but still being active and still getting into routines with the kids and with the family and with work. That's really helped me personally, and I would encourage folks, if you're typically kind of a pessimist as well, I think that can be a negative as well. I think really it's getting into that new normal as soon as possible, because otherwise I think this will wear you down.
Yeah, it's funny you say it's a marathon, not a sprint, and I always think oh, this is the worst marathon ever, because it's not exactly 26.2 miles, right? You actually don't know how long it is, and I think that, right, exactly that. We don't know how long, and that kind of drives how much longer is this? How much longer do we have to deal with it? The new normal is a thing, and you're right. I think the sooner people are able to adjust to new routines, the better that it's going to be.
Concur. Something I've seen out on social media, and I've even chatted with Colonel Bishop about, the feeling that I had for a while, waiting for somebody to jump out of the bushes and yell index, but it hasn't happened yet. This is real, so got to deal with it.
Yeah, sir. I don't know if you've had any thoughts on battling the negativity that's coming out of this. It feels like you're having the same conversation with everyone you talk to. Hey, how are you doing? And it's just this pall that, oh well, I'm just getting by. But I don't know if you have any advice there.
Yeah. So I think one of the things that I've tried to do personally, and just like the chief mentioned, that's really all I can kind of offer is, just first of all, recognizing what a big event this is. This is a generationally defining event for our nation and heck, for mankind. This is, impacting everyone. So if you feel grumpy or you feel kind of down, you're not alone. And that realization for me is frankly uplifting to know that even though we are social distancing and trying to stay away from each other physically, this is a great opportunity to actually connect and have a shared experience with those you love, and then with your teammates, with really all of us. And I see just moments of greatness emerging on a daily basis. People going above and beyond given all the challenges that we're encountering, to really connect and help and give. And sometimes in these most challenging environments is when our greatness is, as airmen and as families and, frankly, as a nation, can really come to fruition. So I think it's important to understand that this is going to be, again, a marathon. I don't know how long it's going to last, but what I do know is that we are going to persevere, and we're going to emerge from this stronger than ever before, because I see greatness emerging on a daily basis. So that's a long way for me to say, if you're grumpy, you're not alone, and look for those opportunities to kind of share those feelings, but also look for opportunities to have fun even amongst this. And one of the great things about COVID is the humor that's emerging from this, and the memes, and look for to have a little bit of levity when you can. A great way of doing that, by the way, is maybe having your spouse try cutting your hair, or somebody in your household cut your hair. Please do not have anyone outside your residence cut your hair, because that's not what we need to be doing. But looking for those unique opportunities to do things that are different are great. It's a great environment to take that approach here.
Yeah, you touched on the community response and everyone kind of being in it together, and we've seen such a great amount of people, coming together specifically to make masks. And I know, Chief, you were kind of talking about how there's Eielson Connect, there's the Spouses Club, there's just individuals, right? The chaplains group. It's been an incredible, show of support that everyone has overcome this challenge. So just shout out to those groups, everyone, individuals or groups, who have been working hard to kind of make this easier on everyone. It's very much appreciated. Yeah.
Can I caveat on that? I definitely echo the thank you. So I see it all over social media. I see it, via email and hear it through communication. Like a lot of people are doing outreach. I think part of kind of getting after the negativity for some folks is feeling like they can make a difference. And one of the ways people are doing that is, by making these masks and helping folks out. So I wanted to say thank you in that regard. But I also wanted to say that if you or someone in your household or coworker, if you need a cloth face mask, like if you do not have a cloth face mask right now, please push that up through your chain of command. Like we were saying, we have volunteers that are making face masks, and if you need one, by all means, we need to know about it, and we'll do our best to get you one. So please push that up through your leadership chain, preferably to your first sergeant. That would be the right person. Please do that.
Yeah, shirts lead the way, for sure. So it's funny, someone just commented, when the snow is melted, will families be enabled to use the outdoor track? Colonel Anger answered right away, absolutely, which kind of just brings me to, the local activities that we can do on base, kind of adhering to the governor's mandate about intrastate travel, trying to stay local and recreate locally and physically, do active things in the local area. Just, is there anything that you guys have been doing in particular around the neighborhoods that have kind of helped you get through this, especially with the sun shining?
Sure. So I haven't had a chance to do this yet, but I do know now is a good time for ice fishing. You can actually ice fish and not sit in a heated tent, so you can sit out in the sun, and it's kind of crazy, but it's still a pretty good time to do that. As far as for me personally, mainly woodworking stuff I can kind of do around the house, hobby type stuff, working on my car, that sort of thing. I think as far as getting out in the neighborhood, we're trying to kind of avoid people, but we are able to kind of get out and walk around and kind of socially distance. So kind of doing some of that.
Yeah, absolutely.
Yeah, for me personally, all the way up to last Friday, I was cross-country skiing on Moose Lake. So it was a great way to get a workout. Like on Friday, I got to cross-country ski and then go fly. So that was a good day for me. But I think those days are at an end now. So I started taking up this weekend is actually running. So I was able to go out for a jog, and the sidewalks were clear. And it was great because my two older kids were on bikes following me. So I've been able to kind of do that and make that a routine. So again, that's a great way to kind of get out, get exercise, and maintain social distance. As a reminder, you can be within 6 feet of your family members or people that live with your residents. So that's encouraged. Just again, stay away from other folks out and about. So give them a wide berth if you see someone coming the other way on the sidewalk. So across the street or to maintain that social distance.
Yeah, give a wave though, right?
Yes,
yeah.
Exactly.
All right. Well, we're coming to the end of our show here, so we're gonna pull some last words from you both. So, Chief, any last words from you?
I just want to say thank you to everyone out there. I know we mentioned the masks, but there are a lot of folks across this community that are just putting a ton of effort in to make sure people are taken care of. So I just wanted to say thank you for that. It's not unnoticed. So situations like this, they can bring out the worst in people. They can also bring out the best in people. And seeing the community come together, I know has really touched me personally. So thank you.
Sir?
So some words that come to mind, duty. So it is all our duty to take part in this effort to combat COVID. And as I alluded to earlier, it's inspiring to see us come together and it's working. I also think of opportunity. This is an opportunity to think differently, to embrace change, and to get after those unique environments that allow us to innovate and think differently. So whether it be how we connect, how we come together as a community, doing that in different means, whether it be how we get after the mission, and you see that happening as well, and then how do we support our community? Again, that kind of leads into my priorities. The last kind of word that comes to mind is just grace. So a lot of us celebrated Easter last weekend. It was also Passover, and those are holidays that commemorate, coming out of darkness and having hope. And I think that this is a great opportunity for us to come together as a community and to emerge stronger, and we're going to do that. So give each other grace, like we were talking about. There's some negativity. Some people are cranky. I've been like that just personally. My wife Erin could probably attest to that. But just give each other grace. Give each other the benefit of the doubt. Because again, like I alluded to it earlier, I see everyone that is really engaged in this environment and doing the right thing. So with that, there's a lot of uncertainty in this environment. I don't have all the answers. I don't think anyone does. But what I do know is we are going to persevere. We're going to take care of our airmen and families. We're doing that. We're doing a great job. We're going to continue to get after the mission. We're going to support our alert requirement and our mission partners here with the 168th Wing. We're going to continue to execute aggressor flying operations, and we're going to continue to bed down F-35. And I'm happy to report that our first F-35s are inbound. They're going to be here soon. It's going to be a great event, and COVID is not going to stop us. And then this is going to be a great event, not just for the base, but for the community as a whole as we're supporting. So again, thank you for your support. Thanks for all the great work, and then keep it up. Valor in combat.
It's good news to end with there, sir. So Chief, Colonel Bishop, thank you so much for joining us. That's all we have today. So thank you to everyone who's been tuning in. Please help us share information by sharing this town hall recording. We're going to continue to answer questions in the comments. Thanks to all the commanders who have been chiming in to help with those comments. And if you still have questions, post them there and we will definitely get to them. So thanks, team. Take care and stay healthy.